Hello, I am Jon Salmanton-García from the University Hospital of Cologne in Germany, and I would like to share with you the results of the ECMM online survey, Laboratory Capacities to Diagnose and Treat Invasive Fungal Infections in Europe. Invasive fungal infections, IFI, are a major threat for patients under immunosuppression or with viral respiratory infections like influenza or coronavirus disease 2019, COVID-19. Access to appropriate tools is vital for early diagnosis and clinical management. Hence, we aim to decipher the current diagnostic capacity and availability of treatments for IFIs in order to guide health professionals, patients, and policymakers. Previous similar experiences have been already reported from other regions. The ECMM IFI Diagnostic Capacity Survey is online accessible. A campaign seeking for mycologist feedback was launched. The survey was disseminated to all European mycologists affiliated with the ECMM and via social media and email. Collected variables were institution profile, perceptions on invasive fungal disease in the respective institution, microscopy, culture and fungal identification, serology, antigen detection, molecular tests, and therapeutic drug monitoring. A total of 388 sites replied to this survey between November 2021 and February 2022. Of these sites, as we can observe in the first graphic, most of them were treating oncological, hematological, COVID-19 or diabetic patients. From the second graphic, we can learn how in the majority of the sites, the general incidence of IFIs was most from very low to moderate. This relevance in proportion was more reduced in the specific case of mucormycosis. From the 388 sites that answered the survey, France, Germany, Italy, and Spain were the origin of most of the participants, with more than 30 institutions per country, colored in dark blue in the map. Answers were gathered from all the sovereign states in this continent except for Luxembourg. Microscopy in red was available in almost all the sites, being always performed in more than half of them. Culture in blue was accessible in more than 350 of the sites, including the possibility to perform species identification and susceptibility tests through e-test, UCAST, and CLSI microdilutions or BITEC method. Serology or antibody detection tests in green was available in more than 300 sites, while antigen detection tests in orange in more than 350, in both cases mainly for Aspergillus detection. Molecular tests, such as PCR in brown yellow, were accessible in more than 300 sites, mainly for pneumocystis and Aspergillus detection. When evaluating the access to systemic antifungals in the respective site, we could see how triazoles in green, mainly for voriconazole and fluconazole, were present in most of the sites. Afterwards, echinocandin in brown-orange with caspofungin leading in almost 350 sites. Different amphotericin B formulations in purple-pink were available also in almost 350 institutions, mainly liposomal amphotericin B. Flucytosine in red and terbinafine in blue, at the very right, were only available in 200 sites or less, each of them. Therapeutic drug monitoring, or TDM, was available mainly for voriconazole in around 250 sites, posaconazole in more than 200, itraconazole in more than 150, and flucytosine in more than 100. With this, we can conclude that Europe is generally well prepared to diagnose and treat invasive fungal infections. However, some institutions miss access to certain diagnostic tools and antifungal drugs. Cooperation between different European institutions and healthcare providers has to be strengthened in order to guarantee an adequate and balanced access to IFI diagnostic capacity in the whole continent. In case you want to have further details in general or from a specific country, please feel free to contact me either via email or Twitter. Thank you very much.